Hi and welcome to the Brian A. Joyce Report. I'm Brian Joyce and I have the pleasure of representing the Massachusetts Senate those folks living in 10 towns throughout Norfolk, Bristol, and Plymouth counties. So it's my pleasure to work on your behalf and to bring to you some interesting and informative guests, those who may represent your interest in one capacity or another on Beacon Hill, or those that may represent your interest on the local level. Or today we have a gentleman who advocates for a significant portion of our viewing population and the fastest growing segment of our population at large, and that is our seniors. Our guest today is Al Norman, who is the Executive Director of the Massachusetts Home Care Association. It's interesting, when I first started in the legislature, I was a champion for home care. And here I was, a relatively young guy, and sometimes folks would ask why I was so keen on this particular issue. And it was born from my own personal experience. My wife Mary and I purchased the home next door to my parents on Ridge Road in Milton. My mother was afflicted with Parkinson's disease and was blessed really with a very devoted husband who cared for her, my father. Mary and I pitched in as much as we could, and my sisters and other family members were all terrific. But she also benefited from these women who sometimes seemed as if they were angels of mercy, these home care workers that would come into my mother's home and help her with some of her daily needs and helped her stay home for perhaps 5 years longer than she otherwise would have been able to. And during that time, she developed a very good and close relationship with my children that they'll always treasure. I remember that my son Mikey, who's now just turned 21 years old this week. He was just a little guy, and he used to make my mother laugh, and she would make him laugh. And she was there when Jimmy came home from the hospital. She was there to welcome him home, and just things that would not have happened in her life and all our lives but for these home care workers. So I worked with Al Norman, our guest today, to help sponsor legislation called the Equal Choice Bill, which for the first time ever gave senior citizens in Massachusetts a choice to receive their care either in the comfort or dignity and safety of their own home rather than being forced prematurely into a nursing home. It was crazy. Our public policy was such that we were providing financial support for an institutional setting that was far more expensive than what 99% of the seniors wanted, and that was the less expensive option to stay in their own home. In 2006, then Governor Romney signed into law the Equal Choice Bill, and I actually have the signed, framed original of that legislation hanging in my office as a tribute to my mother. So I've always had a very close connection and a lot of affection for today's guest, Al Norman.
Thanks. You know, you remind me that we also have something in common, because my dad had Parkinson's. And for 12 years, his main caregiver was my mother. So I know, how difficult. We were talking about how incredibly time-consuming and stressful it is to provide care for someone. And I say that there's probably two kinds of people in this world, those who have done it and those who haven't. Anyone who has cared for a relative who is at all disabled or frail, you don't have to tell them about home care. They're sold on it. Anyone who's never done it, they probably have no idea what you're talking about. But what I've found is that most people on Beacon Hill have a sense that there's something in their family, that a story like the one you told, where people get to understand why it is so important to older people to be at home. And you learned it from your family, not from me. You learned it from your family. I learned it from my family. And so it's really all of this stuff about home care and elderly people, it really comes down to what are we going to do for our families? What do we want them to have for care? And so I've always appreciated the fact that I didn't have to convince you that this was the right way to go. You knew in your heart it was the right way to go.
And yet, it was a difficult measure to get
Yeah.
passed. And I was relatively new and naive and just couldn't understand why there wasn't unanimous support for home care. I mean, at the time, I think the stat was it would cost $40 or $50 or $60,000 to keep a person in a nursing home, whereas $7 or $8 or $9 or $10,000 to provide good home care. It was good fiscal policy. It was good social policy. I'd go in the senior centers and ask, which folks would prefer, the home care or nursing home. 10 out of 10
Never,
would say
yeah.
home care.
Right.
So why wasn't this passing? And you learn the ways, you learn that, first of all, there's always resistance to change, but secondly, there's always someone who has a vested interest in the status quo. And a lot of I think the nursing home operators thought that I was public enemy number one, and I really tried to convey a message. Look, this isn't necessarily a zero-sum game. My mother actually did end up in a nursing home, and I'm all for adequate funding of nursing homes. We absolutely have to provide adequate funding, but to the extent we're able to keep people in the least restrictive setting possible, we have, I think, a moral obligation to do so, and again, good fiscal policy. Where do we stand today on the Equal Choice Bill?
Well, here's the good news. The bill passed in 2006, but between 2001 and today, in the state of Massachusetts, we have cut the use of nursing home days by 29%. Now, that's really remarkable, because all across the country, there's been a movement away from institutions, people saying that they have a right to be cared for at home. But we've actually had a good track record. We've dropped 3.7 million days a year
Wow.
in costs avoided. Now, if you translate that into, if you multiply that by $161 a day, which is what Medicaid pays for someone in an institution, that movement, that equal choice movement of moving people back to the community, I estimate that it's saving the Commonwealth about close to $600 million a year in costs that we formerly would have been spending on nursing homes if we rolled the clock back to 2001. So that's the good news.
Wow.
The bad news is that we still, even with what I just said, we still spend 2/3 of our Medicaid dollars for long-term care on nursing homes. And again, it's not, nursing homes have an important place, and they do great work. But if you don't need to be there, the taxpayers don't want to spend money on a form of care that isn't needed or desired or necessary. So we still need to do what they call rebalance some more. We're not done yet, because $2 out of $3 still goes to nursing homes. We have one of the I think we're like the 9th highest rate of spending per capita in the country for nursing home care. So we still have a ways to go. But I do think that more and more people, and particularly a lot of your colleagues are on the Hill, realize that we want to make our public policy match what families want. I mean, that's when you boil all of it away and ask people, as you said, where do you want to be cared for? Every hand in the room goes up, I want to be at home. So that's why we still have some work to do.
Now, in my district, people watching this show may have familiarity with South Shore Elder Services,
Yep.
Old Colony Elder Services, or HESCO. Those are
Correct.
3 of the agencies in my district. If I need home care or I need homemaker services for my loved one, I call one of these agencies. It's not always as easy as calling and the person comes out. There's still a serious shortfall, isn't there?
Well, first of all, any of your viewers, any of your constituents, they can just call 1-800-AGE-INFO, and they will automatically be connected with the agency from their town, because it's done by phone number.
1-800-AGE-INFO.
Right. So they would just call that number and say, I want to find out what my options are to stay at home. And there are some questions that have to be asked, because the program is available to people with certain income background, and you have to have a certain amount of frailty. But the call is free, so you might as well take advantage of it. We do have financial problems with the program, because it's a combination of state and federal money that makes it work. If you and I had been sitting here last October, I would have told you there's a waiting list of 3,000 people to get into home care, which is obviously not a good message. Today, that waiting list is much smaller, I'm happy to say. By next July, depending on what the budget debate happens on the Hill in the next few weeks, we could be looking at waiting lists again next summer or fall. So it goes up and down, but there's never, I tell people, just make the call, because you don't want to judge yourself. It's like taking yourself out of the race. Rather than saying, I'm not qualified, call and find out, because there's a lot of services that are not based on income or assets that are available for everybody. And so,
what are some of the services?
Well, the main service we're talking about for home care is what we would call personal care. That's help with eating and bathing and dressing and walking and toileting. They call those the activities of daily living. But it also includes shopping, transportation to a medical appointment. We're pretty creative in matching a service with a need. So if there's somebody, we can help find people new housing. We can help them find caregivers. People can hire their own family members these days to be caregivers. I don't know, many people don't know that, but we've got a lot of flexibility built into the system now that really is designed to, again, give people care the way they want it, where they want it. Mm-hmm. So the main service that it gets offered is personal care.
So what are some of the other challenges that you're facing? Now we've talked, I guess, before the camera started rolling, how this segment of society, our seniors, is our fastest growing segment by far. The census data just became available to us, and now we even have the baby boomers, right, are on the cusp now of becoming
right.
senior citizens. But even those folks beyond not just 65, but beyond 85 and beyond 90, I mean, it's just really just, we've never seen this many seniors. My own dad, who lives here at Fuller Village, where we're taping this show, is 91 years old, and will celebrate his 92nd birthday this year. He's still quite vigorous, but has clearly outlived any other family member and people of the previous generation. We're living longer.
Right.
What are some of the other challenges facing our seniors?
Well, again, we have, this is a wonderful facility here at Fuller. I was pretty impressed in coming here, but finding appropriate housing for people is difficult. I'll give you an example. We several years ago, my group, Mass Home Care, started to find some housing partners who would buy ranch houses, single-story buildings. And we would place 4 people in those facilities who were nursing home eligible but could be in the community. We called it the Back to the Ranch project. I got a little bit of private foundation money to start the thing off. And we started to use some Medicaid money to pay for the services, and the elders would pay their room and board. It was a great combination. So we had 4 of these created, 4 of these little Back to the Ranch projects. The federal government saw a story about it on the front page of the Globe, called up the state and said, you've got to regulate these homes. You need more regulations. That was 3 years ago. We still haven't added a single home in the last 3 years because of red tape. We've been tied up in red tape. And if I ran the zoo, I'd be saying, I want you to cut the tape. I want more of these houses, because I want to make sure, this housing development is wonderful, but we need more. We need more housing. We need it in the neighborhood. We need it in people's communities, and where they can actually move into a place and not have to live in an institution if they don't need to be there. So projects like that, housing. The key to that, Senator, is it's housing with services. So, for example, these little ranch houses that we bought, they've got 4 people in them. There's 24/7 staff, and they get their food is cooked right there. So it's a home. It's not like a home. It's a home, and we could be doing so much more in that direction than we're doing today. And all of these people that are in these facilities would be otherwise in an institution. So the taxpayer wins and the consumer wins. So that's an example of just sort of mind-boggling, bureaucracy preventing something simple and basic from happening. We've also filed legislation to allow spouses to be paid as caregivers. Do you know that in this state now, if I was disabled and qualified for the personal care attendant program, I could hire one of my 3 lovely daughters to take care of me, but I can't hire my wife. It's against Medicaid rules to hire your spouse. But states like Wisconsin and Arizona have gone ahead and done it, and I think California and Oregon, other states are doing this and have been doing it for years. We are going to need every caregiver we can find, and if you have a spouse who's still able to do that, pay them. Get whatever we need to do to keep the person living at home. It's little things like that that I think make a big difference. There's another program, personal care attendant program, where we don't let people into the program if they have Alzheimer's, because if they need cueing and supervision, we don't consider that to be eligible for this program where you can hire somebody from a neighborhood or a relative. Why do we treat people with Alzheimer's with that kind of disregard? They got the wrong disease? It's just not fair. There's no rational reason why we can't make the personal care attendant program available. But just like you said with the Equal Choice Bill, why did it take 5 years to pass? Some things that are very common sense and reasonable don't happen for years, and you sort of have to just keep being persistent to make them happen, as you know, because you stayed with us the whole time. But these are the kinds of things that we need. We just need to get better at what we do to keep people at home and not let red tape stand in the way of a person's well-being. It just doesn't make any sense, particularly when it saves money.
One of the things that I know you've talked about a lot in the last few years and made great efforts to reduce is the incidence of elder abuse.
Yeah.
And elder abuse comes in quite a few forms, but you talk a little bit about that?
Yeah, it's a great question, because we have in this state now, we receive about 54 calls a day of elder abuse. Now this could be mental abuse, it could be physical abuse, it could be financial exploitation, and finally it could be self-neglect. You know, people who are outside in the winter with no coat on, and a neighbor spots them with no shoes on. So it can be, you know, and they go into the home and there's no food there. So all of those forms of abuse and self-neglect are all contained in one law that we've had in the state since the mid-'80s. And the problem there is that the funding for the investigators to go out and actually work on these cases, and some of these cases are very volatile. You know, that you can imagine there's a perpetrator. The bad situation is that most of the perpetrators of elder abuse are in the home. They live right there. It might be a son, it might be a daughter, it might be a husband. But elder abuse is usually not at the hands of strangers, unfortunately. So the idea of like an older person being broken in on by a stranger, that's really not the norm. The real situation with elder abuse is someone who's taking care of an elderly person, and they're just so frustrated and so stressed that they start taking it out on the elderly person. But this program is underfunded, and unfortunately we took a cut in the program last June, and it never got restored. So we're trying to get another $1.5 million. The whole program in its entirety in Massachusetts is only about $15 million. Now we spend 31 times more money on child abuse and domestic violence than we do on the elderly. Now child abuse and domestic violence are critical services, but 31 times more funding than for elders. I mean, again, it's a matter of equity. So we're trying to get some more money into this program, because what happens now is we get a report of elder abuse, and unless it's a real crisis-breaking situation, in our opinion, we may not investigate that abuse at all. And then you get it back five months later, and it's gotten a lot worse. So it's, you know, without enough investigators, the abuse festers and gets worse.
So what does a person who might be watching this show, who may feel that he or she is abused by, whether it's a caregiver or a family member or someone physically abused, what do they do?
Well, first of all, any member of the public can report abuse. Under the law, there's a certain number of mandated reporters. People who are
that are required by law to report
absolutely
abuse.
Yes, mandated by law to report. Doctors, nurses, people at hospitals, people in basically the home health network. These people are all required. Police, they're firemen. They're all required to report instances of alleged abuse. By the way, it doesn't have to be I've proven it. It can just be that there's a reasonable cause to believe that someone is being abused. Those people must report. But anyone at all, a neighbor, a friend, can report abuse. And again, they can call 1-800-AGE-INFO, same phone number. And when you call that number, there will be a prompt that says if you want to report a case of elder abuse, press 3. So if you just call that number, you follow the instructions, your report gets made.
Can it be anonymous?
Yes.
Okay.
Yeah.
So another form of abuse is really self-abuse, self-neglect,
Yep.
right? Someone who's no longer capable of taking care of themselves.
And this is a sad situation, but we have this part of the law was added about 7 or 8 years after the original law was written. I'm proud to say that Mass Home Care played a role in writing that law. But the self-neglect issue is the person who just can't keep up with taking care of themselves. There may be some dementia involved. There may be some disability that's preventing them from being able to, eat well or dress and take care of themselves, keep the house warm. They may not have enough money. The house is freezing. But whatever the alleged abuse is, the reason to make a report is that it allows us to then work with that person to alleviate and mitigate the problem, which, in most cases, 9 times out of 10, and there's a very simple solution and resolution to cases of self-neglect. Sometimes people need a guardian. Sometimes people have no surrogate who's looking out for them, and we can help make that happen. So I always say to people, you may feel like you're being a snitch or you're telling on somebody, but if you do nothing, the person's situation could deteriorate. And again, it's not just looking for people being slapped around or physically abused. If you hear somebody being yelled at or somebody being denied medication, the abuse takes many, many forms. So if you're in doubt about it, you call that number. We will investigate, and we'll find out whether it's a legitimate case of abuse. With the caution that if we don't have enough money, some people don't get an investigation. That's what bothers me, is that...
So a couple of takeaways. One is, if people have issues really with respect to senior care, if their issue is we may need home care, we may need some other services, we may have a person who's not taking care of him or herself, we may have a person who's being abused, they should call 1-800-AGE-INFO as a central repository of information
right, and they, again, the watchword is know us before you need us. So every one of the agencies that we mentioned earlier in the show, South Shore Elder Services, Old Colony Elder Services, HESCO, they have information and referral workers. So if I have a question about, would my dad be eligible for this, or I heard about that cash benefit program, or what about food stamps, make the phone call. If you call 800-AGE-INFO, you're automatically connected, to the agency that's serving that area, and ask them the question. There's no such thing as a silly question. Ask it before you eat it.
I can attest to the extraordinary work done by each of those agencies, and have a long experience with each, and certainly can attest that. And I also wanted to make a takeaway, kind of make the point that as difficult and as challenging this environment is that we're in, and frankly there just isn't as much money as would need with a declining economy, there still are some extraordinary resources available. Thanks to your advocacy, thanks to the work of a lot of good people, there are some great resources available to our seniors, and these agencies can help direct you to some of those resources, even if they can't provide them themselves. We've come a long way, I think, since Lyndon Johnson's old age pension and going back to Roosevelt. I mean, we've come a long way, and here in Massachusetts, despite obvious room for improvement, we've made great strides just, I think, during the time that I've represented the folks I work for in the Senate.
Right, and I don't have much chance to do this publicly, but I want to thank you for your support in all of these senior issues, because you and I know, but your viewers may not, is that you were the first lawmaker who took up the equal choice cause. This whole notion that people have a right to be cared for in the least restrictive setting possible. That, because of that law, it now says that in Medicaid. Now, Medicaid is over $2 billion of long-term dollars, so we're not talking about a little pot of money. That $2 billion, the mission of that money is to help people stay at home because of the work that you did, and because
you indicated the savings has been $600 million.
Yes.
Can I get a piece of that?
Yeah. What would you like?
Enough to pay the kids' tuitions, if I could.
Yeah. Yeah. All you have to do is become disabled. We'll take care of you.
Well, I will tell you that one of my favorite quotes. I spent some time with a nephew today who loves politics, and unfortunately his mom is sick, and we were talking about a bunch of different things, and we were talking about different historical characters and leaders in politics, and I said, learn about Hubert Humphrey, because he's a young liberal, and I said, learn about really just what a champion he was, and one of his quotes was, the moral test of government is how that government cares for those that are in the dawn of life, the children, and those that are in the shadows of life, the poor, the sick, and the disabled, and those that are in the twilight of life, our seniors. And I do believe that we have a moral obligation in government, each to each other, to care for those children that naturally look to us to prepare them for the future, and to care for those who perhaps aren't in a position to care for themselves, the poor, the sick, and the disabled, and also to care for those that cared for us. To each generation, there's an intergenerational responsibility, and we certainly have a responsibility to our parents and our grandparents, and it is, I think, the moral test of government, even in these challenging times, and in a fiscally prudent manner, figure out how to address those challenges and keep that pass that moral test, I guess, and keep our responsibility. So I appreciate the work that you've done. I appreciate your joining us here today. Any last thoughts you'd like to give to some of our viewing audience, and particularly those who, if they're not seniors, they're heading there? Well,
just remember this. Every time you see an older person, this is somebody's mom or dad, and they should be treated that way. And I try to do this in my own work with elders, is that I'm looking at the person in front of me like they're my mom. Because it really just gives you a better perspective on why you're there and why it's important. That it's stripping away what government does. Just take care of these people because they're somebody's mom or dad and they mean a lot to somebody. So treat them that way.
There you go. Well put. Thank you for joining us. I'm Brian Joyce. We'll see you next time.